Hello everyone, I am Kaloki and this is my response to the module 4 assignment. This video is a two-part response. The first part involves a virtual scenario describing a situation that may occur in a work setting. The second part involves a research question in which I will be addressing the issue of mental illness management, and my response will be based on research data from the textbook as well as other academic sources, and a list of references can be found in the video description below. Let us first look at the scenario, which is about a 53-year-old lady brought to the ER by EMS after being found wandering in a nearby park, disoriented and having suffered a fall. From the scenario, there's some crucial data on symptoms that we need to isolate to better understand the condition of the patient. These symptoms include the patient is using foul language, is disoriented, is combative, and her hands are shaking. She is also experiencing delusions, and she presents with poor personal hygiene. Based on the research I conducted on the symptoms that the patient presents with, I suspect that the patient may be suffering from one of two conditions. First, I suspect that the patient is suffering from a mental illness, such as schizophrenia. In our textbook, Focus on Pharmacology, published in 2018, Moini states that schizophrenia affects about 2 million people in the United States. The tentative schizophrenia diagnosis is based on her symptoms, which coincide with those of people suffering the same disease. According to Ramanuj and Rublee in their 2016 article titled Schizophrenia, an overview is the title of the article. Some of the symptoms of schizophrenia include delusions, hallucination, disorganized speech, and behavior. So the patient in the scenario presents all these symptoms, and this alludes that she may be suffering from schizophrenia. In addition, schizophrenia is characterized by a reduced level of functioning in self-care, work, and personal relations as one of the criteria for the schizophrenia diagnosis. The patient presents with poor personal hygiene and uses obscene language, and this shows that her level of functioning in the aspects of self-care and personal relations is reduced, which are symptoms are found in schizophrenic patients. Secondly, I suspect that the patient may be suffering from a drug addiction, because according to a 2020 article by the American Addiction Centers titled Symptoms and Signs of Drug Abuse, some of the symptoms and signs of drug abuse include delusions, increased aggression, poor personal hygiene as well. These symptoms are observed in the patient from the scenario who was deluded, combative, and had poor personal hygiene. This patient is just asking for a bottle, which is possibly related to the drug use behavior. Maybe that's where she keeps the drugs that she abuses. The second critical thinking question is on the short-term and long-term health risks that the patient faces. First, the patient faces the risk of infections, especially because of her poor personal hygiene. Secondly, I suspect that if the patient has schizophrenia, they may be facing health risks associated with the comorbidities of the condition. According to a 2020 article on schizophrenia by Henny and colleagues, some of the conditions related to schizophrenia include having a suicidal ideation. This article points out that schizophrenia diagnosis correlates to a 20% reduction in life expectancy as well. Another risk that the patient faces is the risk that may be the negative effects of the drugs abused. Excuse me, if it is found indeed that the patient has been abusing drugs. The third critical thinking question is on the possible causes of shaking the patient's hands. There are two possible explanations for the shaking of the patient's hands that are consistent with her potential diagnosis. First, the hand tremors may be induced by her drug abuse. According to Rookie and Steele in 2020 article entitled Neurobiological Complications of Alcohol and Substance Misuse, drugs such as alcohol are associated with neurobiological disturbances, which manifest themselves in involuntary movement and shaking of hands, like in this case. Secondly, the shaking of hands to the patient may be related to a condition called schizophrenia. In their 2017 article, Van Harten and colleagues argue that schizophrenia and other mental conditions that involve psychosis are associated with motor abnormalities. Some of these abnormalities include hand tremors and involuntary movements. The final critical thinking question for the virtual scenario include activity is on the assessments that are needed for the patient. First, since the patient is suspected of using drugs, there is a need to conduct a number of tests to identify or rule out drug abuse. These tests includes for the ones for alcohol and opioids. So another form of assessment that the patient needs is a mental health assessment. Part of the assessment should include locating and questioning friends and relatives of the victim, which provide data on medical history that might be crucial to her diagnosis. So this marks the end of the first part of the assignment. The second part of the assignment involves addressing a research question on mental illness management. Generally, the management of mental illness involves a two-pronged approach that combines pharmacological and therapeutic methods. According to a 2020 article by Coventry and colleagues, the pharmacological interventions are the drugs and are given to alleviate the mental illness and their symptom, and they include drugs such as antidepressant, antipsychotics, anticonvulsants, hypnotics, and anxiolytics. So, on the other hand, Coventry and colleagues characterize the therapeutic methods as psychological therapies that are meant to help the patient suffering mental illness to deal with them. These interventions include cognitive behavioral therapy, stress management, hypnotherapy, supportive therapy, counseling, interpersonal therapy, acceptance, commitment therapies, and many others. When mental illness management involves a combination of both pharmacological interventions and therapeutic methods, it is not always sufficient. This is according to a 2018 article titled Measuring and Improving the Quality of Mental Health Care, a global perspective by Kilbourne and colleagues. The quality of care of mental health disorders has not evolved at the same pace as that of physical conditions. Some of these challenges to the provision of proper mental health management interventions include scientific evidence to the effectiveness of some of the interventions, the cultural barriers to the integration of mental health care into the general health, public health system, and the lack of proper training and support for providers of mental illness management intervention. Another challenge of mental illness management is insurance coverage for mental illnesses. While insurance companies cover mental illnesses, the patients experience a number of problems that make it difficult to access the care they need. This is according to a 2017 report by National Alliance of Mental Illness. Some of the challenges faced include denials of care by the insurance, high out-of-pocket payments for mental illness management, difficulties in accessing medication, among others. In some instances, patients may have to travel long distances to access the mental health care. Finally, while mental illness management remains a challenge, there are various strategies that can help to make it better. One of the strategies is to empower families and caregivers of the patient to strengthen the provision of mental health care. The other one would be support groups, counseling for the caregiver burden, psychoeducation, and financial assistance for the families and caregivers of people with mental illness. The second strategy is the collaboration of different healthcare providers to facilitate a holistic mental illness management regime. According to Mapanga and colleagues, the integration of information technology can be crucial in the success of this intervention because it helps share the patient information with different healthcare providers and facilitate optimal decision making. Finally, Mapanga and colleagues suggest that early detection of mental illness through screening can help to identify at-risk individuals and introduce interventions that can prevent the escalation of mental illness. For instance, individuals who go through traumatic experience like PTSD, an early screening can help to identify this predisposition and start the therapeutic interventions early. In summation, mental health management involves a combination of pharmacological and psychotherapeutic interventions. However, these are not always enough. So there are strategies that can be used to intervene and make sure mental health is successful. Thank you for listening.